Good evening and welcome to Hatching for Health, the Jessica Hatch Show. Today we're going to be joined by Theresa and her son Owen. Now, Owen has Beckwith-Wiedemann Syndrome. This syndrome is known to have children with enlarged tongues, as well as overgrowth of the body, sometimes even one side growing larger than the other, and there is potential for abdominal malignancies. So thank you, Theresa and Owen, for being here.
Thank you for having us.
Yeah, very exciting. Hi, Owen. So you just had a birthday on Sunday, huh? You 3 years old?
Yeah. I'm 3.
You're 3.
You're 3. Wonderful. You are a big boy for 3. You have an older brother, is that right?
You have an older brother? Who's your older brother?
Michael.
Michael. You say that?
And how old is he?
How old is Michael? How old's Michael? 6? He's 6?
I
No?
heard you say you were 6 years old. So I figure maybe that's because of your brother, but
Oh, I'm 3.
You're 3.
I'm not 6.
I'm not 6. You're changing your mind now?
yeah, we don't want you to be 6 yet. We want to slow down there.
No.
So Theresa, I've never heard of Beckwith-Wiedemann Syndrome. Tell us about it. Tell the viewers. I think this is an unfamiliar condition to a lot of us. So kind of tell us about what exactly that is.
Sure. So I never heard about it before either until we had Owen. And basically it's an overgrowth disorder that affects his rate of growth. It's a spectrum disorder, so not every child is affected the same, which makes it really difficult sometimes to diagnose. For us, Owen had a lot of the typical, more obvious signs. So getting him diagnosed is a little bit easier for us, but a lot of other families, if their signs are more subtle, it's a little bit more difficult. And also not a lot of doctors or physicians are aware of it either. So we became aware of it because of him, but he has an increased risk of cancer with it, and it does for him make him very large.
Okay, so was he born, or I guess let me say, when he was born, was it something that they were able to diagnose like right away, or were there things that they needed to kind of watch as he was growing to come to that conclusion?
So when he was born, when I was pregnant with him, felt like something wasn't right because I was measuring so big, and he was also measuring really big. And his tongue, you could see on ultrasound. But then when he was born, he was very large. He was almost 12 pounds. And
Wow.
his tongue, yeah, he was really big.
Yeah.
His tongue was out, and I was a little concerned, and my husband and I noticed it. And at first, the pediatrician told me that he thought it was just swollen. He did casually mention BWS, but said, it's really rare. That probably isn't it. And it was actually the nurse that was taking care of me and Owen that said, I don't think, your son's beautiful, but I think you should push the issue on that. So he wound up going to the NICU because he had low blood sugar, which is also a sign of this syndrome. So he went to the NICU, and I started to push the issue about his tongue, and then they started to really kind of look at him, and they noticed one side of his body was bigger than the other, which is another sign. And so that was when they kind of were like, okay, we need to investigate this, and they contacted Children's Hospital of Philadelphia, which we luckily live close to, and they have the top BWS team there, and so they sent pictures over, and that was when they were like, we're pretty sure this is what he has. He obviously will need to come here and get evaluated. But so for us, it was fairly quick.
Wow. Is that what are the numbers on this? Is it one in every? I read it around 1 in every like 13,000. Is that accurate, or somewhere around that? Have it?
Some statistics say 1 in 11,000, some say 1 in 15,000.
Okay.
It's usually in that range. It's a little bit difficult, and the numbers are kind of probably different than that because a lot of kids go undiagnosed. So
Yeah.
the numbers that I usually see are anywhere between 1 in 11,000 to 1 in 13,000.
Okay. So when when you were still pregnant with him, and they were seeing the enlarged tongue, is that correlate with any other conditions, or is it simply this is the only one out there that could be?
I know that the only other condition that I really know of, and I could be wrong, but I know sometimes BWS children get mistaken to have Downs when they're born, or sometimes in utero, just because having an enlarged tongue or a tongue that sticks out can be a characteristic of Down syndrome. But they didn't really say much about his tongue in utero. I noticed it, and they did say it was large, but that was kind of about it.
Okay. So that wasn't something that, it's just like an obvious, this is the only thing it could be. And when you say that, from a baby who actually noticed that one side was bigger than another, because I know I don't have the best view of him right now, but it looks very symmetrical. Is it a very slight difference, or is it more obvious when you're looking at someone standing straight up?
So for Owen, his is very, very noticeable, especially if he's just in a pull-up. His does change when he has a growth spurt. Sometimes the other side catches up a little bit. It's always different. But for his was very, very noticeable at birth. Some kids, theirs don't happen, or the other families that I've come in contact with, their heavy hypertrophy, which is what that's called, doesn't show until a little bit later. So it is different for everyone, but for Owen, his is pretty obvious.
Okay. And I guess, so for you guys, it was like noticing symptoms at birth. It wasn't something where, you're going home and then wondering what's going on. So was it before you guys left the hospital that he was in fact diagnosed with it?
So he was officially diagnosed 2 weeks later. The genetics team at Children's Hospital of Philadelphia, I was able to get an appointment with them because they were in contact with the hospital that I delivered at. And because he was an infant, they wanted to see him quickly. So he was about 2 weeks old when they officially diagnosed him.
Wow. So yeah, very young. What was that like? Because I know you have another child. So at that point, I guess he would be around 3, who's healthy to my knowledge, doesn't have this condition. I guess, what was that like, knowing that, he's being stamped or labeled with this condition that you now have to kind of learn about how to live with it and what all that entails? What was that like for your husband and you in that moment?
I was very overwhelmed.
Yeah.
I was very overwhelmed. One of the hardest things for me was that his signs and symptoms were so noticeable, and the first thing everyone commented on was his tongue. And it wasn't, I was never ashamed of him. I loved him exactly how he was, but I just felt like people saw his signs and symptoms before they actually saw him. Yeah. And that was difficult for us. And just the cancer risk as a new, as a mom, is just very difficult. So his first year with his tongue surgery that he had, and just absorbing it all, was really, really difficult. I felt really lonely. And just, I have a good support system, but it was difficult.
So, and he did, I know before we started the show, we were talking a little bit, so he actually had surgery, right away within, you said 6 weeks or 7 weeks or months?
Yeah, he was 7 weeks old.
Yeah. Oh, weeks. Okay, it was weeks. Yeah. So you kind of immediately, I guess probably with doctor direction, kind of solved one of the things that I guess probably bothered you and him most. Is that right?
Mm-hmm.
And
yeah, so I was concerned. I noticed when he was feeding as an infant, he would choke a lot. And it just seemed very difficult for him to breathe, and very difficult for him to eat appropriately. And so I wanted him to be monitored, his oxygen level to be monitored. So we bought the Owlet pulse ox and put that on his foot while he slept, and just kept him in the room with us next to our bed, because I was never really comfortable, because I was nervous that he wouldn't get enough air while he was sleeping. Yeah. So that did alert us a few times that he wasn't getting enough air. So it was around then that he had a sleep study, and the sleep study confirmed that he had obstructive sleep apnea, and they didn't want to mess around with it. And they said, because usually they don't do them that young, but because of his sleep apnea, for him it was the safest choice.
Okay. Now, something exciting that you've gone and done is you've actually started a clothing apparel line for rare conditions. And I noticed, I believe, is y'all's shirts, one of y'all's shirts?
Yeah.
Okay.
This is one of our shirts, yeah. This one just kind of explains, it says skin anxiety on it, and it just basically explains what it's like for us BWS moms, because they get cancer scans every 3 months, and it's kind of a very big roller coaster of emotions. You feel really good once you get the okay that they have a clear scan, but then 3 months later you're right back to the drawing board kind of. So this is one of them, which we're pretty excited about.
And when did you start that? Was that recently, or have you had it for a while?
So I actually connected with my business partner, Christine, who owns it. She has a rare disease, and she started it because she felt lonely, and she just felt like the need to connect with others. And I came in contact with her through social media, and because I was doing a blog, and we just decided that we should join forces and we would make a bigger impact. So I joined with her in 2019, and I'm very grateful because it's connected us with so many families across the world, and we've just been able to not only connect with others but also raise money and give back. So we give back 15% of every purchase to a nonprofit of people's choosing, which they can select when they check out. So
That's
it's
incredible.
been really cool. Yeah, it's been a really cool thing, and really good for me just to have something positive, because sometimes you need a distraction with this condition because it can be stressful. So I'm very grateful for where I am right now.
Yeah, I think that is really exciting. I know Avery, our guest coordinator, who connected us with you, had talked to us about it. She actually, we got me a shirt, was wanting to wear it today, but it delivers on Friday, so I'm excited to wear it. And just how you've gone about, you're supporting your son having a rare condition, but then in fact, how you've gone, an extra mile and said, hey, you know what, 15% of the proceeds, let's support whoever they want to support, and allowing them to, have that option. I know Amazon does that. And I think that's such a unique thing to be able to, to support something with the money fully being paid, rather than, at the end, do you want to pay an additional $5, to support this?
Yeah.
It actually is a part of the purchase. So, kudos for you for starting that. I think that's a wonderful idea. Do you guys also have a website, or what is the website? I know we'll probably talk to the viewers about that at the end as well, but is it Rare? Is that in part of the website name?
Yeah, so the name of it is Rare, and our website is www.findyourrare.com.
Okay.
We also have a podcast that we do to get other people's stories out there, and just a whole bunch of different things to just try and connect us with as many people as possible, and just give people a voice.
Yeah. Well, we'll have to do something else together, because that's really wonderful. It's exactly what we're trying to do here is create awareness for these rare conditions, and our ultimate goal is to help find cures, if not just live with that condition and have a better way of life. So we do have to take a commercial break, but when we come back, we're going to be joined by Dr. Aguilar. He's a plastic surgeon here in Houston, and we're going to talk a little bit about this condition and get his expert opinion, and allow Theresa to visit with him as well. So we will be right back after this commercial break. Hi, I'm Jessica Hatch, the host of Hatching for Health. We are a show that was brought about to create awareness for children with rare diseases, disabilities, and disorders, with hopes of finding cures. We are looking for doctors that would like to participate in being on our episodes, and possibly even bring their own patients on the show to talk about how they have helped cure them, whether it's been surgically or through medication, or any sorts of ways. We think that it's very inspiring for others to learn these stories and to possibly help somebody else. So I encourage you to reach out if you are a doctor who is interested in being on the show and allowing us to highlight not only you, but the work that you've done for a child. You can reach out by emailing at info@hatchingforhealth.org. That's info@hatchingforhealth.org, and we look forward to hearing from you. Imagine hearing the news as a parent that your child has been diagnosed with a condition that is degenerative or life-threatening. Now imagine being told that there's little to no research for the condition that even exists, making it difficult to try and figure out what to do next. The reality is that for so many rare conditions, finding specialists who understand the condition and being able to make informed treatment decisions for their child is very challenging. Each episode, I will help with my network of physicians and medical resources across the U.S. to attempt to connect the dots by bringing widespread recognition of rare conditions and connecting families to the best treatment, clinical experts, resources, and support. I'm going to highlight these hard-to-diagnose diseases and offer in-depth awareness for families of children in the rare disease community. I believe we are all in charge of our own healthcare, and pushing for answers and creating awareness for these various rare health conditions can make the world around us a better place. Not only am I a huge advocate who seeks to spearhead the fight to bring rare conditions to the forefront of research, but I personally had my own rare condition. In this rare condition, I was able to be cured of due to early detection. My passion to help others was fueled by that experience, and it has led me to start the Hatching for Health show. Now, this show is a vehicle for us to create awareness to help these children find cures. Welcome back from the break. If you've just joined us, we have been visiting with Theresa Thomas and her son Owen. Now, Owen has Beckwith-Wiedemann Syndrome. So we are fortunate enough today, we're going to be joined by Dr. Aguilar in this half of the segment, who is a plastic surgeon here in Houston, Texas, and he's going to talk to us a little bit about this syndrome and visit with the family. So thank you, Dr. Aguilar, for joining us. How are you today?
I'm great, and thank you for having me. It's a real pleasure, Jessica.
Yeah, so I know that you are familiar with this condition, and I thought it would be good to, from a doctor's perspective, just to kind of talk a little bit about your knowledge of it, and then see if there's any questions we can answer of Theresa's.
Sure. It's a very uncommon problem. It usually arises from a chromosomal 11 aberration. Interestingly, with a lot of childhood problems that involve chromosomal abnormalities, there's usually a high hereditary component. In this syndrome, it's only 15% of the cases that seem to have some hereditary component, which means 85% of them are sporadic, spontaneous cases. And it's my understanding that Owen had one of the many hallmarks of the disease, which is an enlarged tongue. And he's very fortunate because this is a wide-reaching syndrome that can affect the abdominal wall. Sometimes when these children are born, the abdominal wall is not closed. It can affect the adrenal glands. It can affect the facial structures. And sometimes with the tongue being enlarged, they can't breathe as well, and sometimes even need an emergency trach, which is fairly scary. In Owen's case, I know that he had a tongue reduction because he was suffering from sleep apnea, which is consistent with a large tongue. So he's doing very well, apparently, and I'm very pleased. It's a very difficult syndrome. Yeah,
it absolutely is, and we've learned quite a bit about it in the first half of the show. Theresa, as it relates to that surgery that he did, that was something that everything went well, and they were, I guess, aware that that was the condition causing it?
Yeah, he did really well. His tongue was really big when he was born. So they gave him a sleep study, and the sleep study showed that he had obstructive sleep apnea. So because he was so little, that's why they decided we're going to do this now to try and, get rid of the sleep apnea. Because when he was sleeping, we had the outlet monitor on him, and it did alert us a few times before his sleep study that he wasn't getting enough oxygen. So he did really well with the surgery. His tongue has grown if they need to do another one, because his obstructive sleep apnea is still gone, but now it's affecting his jaw. So
interesting.
Deciding when they want to intervene again.
So Dr. Aguilar, is that common where the surgery is actually done to to decrease the size, but then it continues to grow and enlarge itself over and over again?
Sure. It's not a common problem, but when you're doing the surgery as a surgeon, you want to make sure you don't destroy the tongue totally. So the blood supply is really important. So you start trying to be conservative in the amount of tongue that you resect. However, as the swelling goes away from the surgery, you may find that you didn't take enough, or it continues to swell and stay swollen.
Okay.
The tongue is very important for formation of the jaw and formation of the upper teeth and the hard palate. So all of that is tied into the mass of the tongue affecting the growth of the bone of the jaw and the palate, which is the upper maxilla. So it makes sense to me they may have to reduce it again a little bit more because it's getting in the way of airflow, causing sleep apnea.
Yeah, and I know too, there's a lot of potential for that abdominal malignancies, but I guess that was something that has not been an issue with Owen. Is that right, Theresa?
Yeah, so far, thankfully so far, all of his abdominal scans and blood work that they do every 3 months have been good. They haven't, seen any masses or anything like that so far, so we're grateful for that.
Yeah, absolutely. Is that Dr. Aguilar? Is there anything else that you've, I guess, seen or heard come along with this condition that has been life-threatening, or just kind of an opportunity that you've come across to learn something different that we might not know?
Well, as I said earlier, there's been a lot of problems with some of the organs in the abdominal cavity, like the adrenal glands, which are one of the master glands of the body. And as long as he's showing good adrenal cortisone production, he's doing well. And I'm sure that they're watching all the organs, and the adrenals sit right on top of the kidneys, so they've got to kind of watch kidney function and adrenal function at the same time. How's his intellectual capacity? Is he doing really well? Is he learning and progressing well?
Yeah, he's doing really, really good. They're actually, really, really happy with, how he's doing with his speech. He has speech therapy, so he's talking really well, and even has a really good vocabulary for his age. He just turned 3. So in that sense, like intellectually and in physical sense, he's doing really, really good.
Yeah, that's one of the great things, is this one doesn't seem to affect the mental status very much at all. So these kids can grow up to be very normal intellectually, which is documented by Owen, speaking well and acting like a normal kid.
Yeah.
Yeah.
Theresa, is there anything that you'd like to ask Dr. Aguilar that maybe is on your mind? I know you see quite a bit of doctors, I'm sure, with his care, but if there's anything that we could ask him, I'd like for you to do so as well.
I guess I'm curious, because it seems that depending on which surgeon you see for the tongue, there seems to be like a difference in opinion of when to do a tongue reduction surgery when sleep apnea isn't present. So I guess I'd like your take on that. When sleep apnea isn't present for these kids, when in your opinion, you would do
Well,
one?
I think if the sleep apnea is present, that sort of makes your decision for you, because you can't have him obstructing at night when you're not watching him. So as he grows, the sleep apnea should become less and less. And he's already had that threshold where he needed the surgery. But now they're looking at how it affects the growth of the bone. So that's going to be your answer. Is his bite developing normally? Is the bite becoming an open type bite? Is the jaw structure looking normal? Those are the questions they're going to have to make decisions on as they see him. They should be seeing him every 6 months or something like that for the next 2 to 3 years, because it's his active growth phase. And I think that will help make the decision whether they need to go back in and reduce the tongue size some more. The tongue is a very versatile organ in our bodies, and it really responds well. As long as you're safe in the way you do it, the tongue can really redevelop nice. The plasticity of young children is amazing.
So in your opinion, if a child like him doesn't have sleep apnea, are you saying that you should wait to do one to see how it affects their jaw?
I would say yes. If they're not having a problem with sleep apnea and speech is progressing normally, then I think you can be more conservative in when you interrupt or intercede, so to speak, against the tongue. And he's already had it because of the sleep apnea, but putting that aside, if he's doing well with speech and breathing, then you can wait. Absolutely.
Yeah.
What kind of healing does that look like? I mean, you've obviously experienced it with him, Theresa, and Dr. Aguilar. You've, been the doctor, with performing those surgeries, or a colleague of yours. Because that's something that, it's all day saliva, eating, drinking. So how is a child able to, heal that properly following surgery?
I'll let her answer first. She's already lived with that.
Yeah, tell me about that.
Owen healed really, really well. He, he didn't have any issues eating. I think his drive for hunger kind of outweighed his his pain. He just wanted to eat, so he did really well. It was a little bit of a challenge because there was excess drooling, but in terms of him feeding, once he healed, it was a couple weeks until his stitches completely dissolved. But once he completely healed, he ate so much better than he did before it was, operated on.
And what age was that?
He was 7 weeks old.
Okay. Yeah, that's probably helpful at that age. Yeah.
Yeah, he was little.
Yes. And one of the things that I want to tell your viewers is that anything you operate inside the mouth, it's very quick healing.
Okay.
We know that when we do cleft lips and palates, the children heal very quickly. When we do tonsil removal, for instance, the tonsillar area heals very quick. Any cuts inside the oral cavity usually heal quickly. So it doesn't surprise me that Owen had a very quick recovery from his procedure.
Okay, so that's good to know. I would think the opposite, it's trying to heal, but it's constantly, having that saliva. But I guess that's
Right.
maybe a good thing, the moisture. So that's good to know. Now, with Owen and his growth, I know that's one of the typical symptoms is that they grow larger and maybe faster than other children. Is that something, Theresa, that you've seen in him? He does look like a pretty big 3-year-old. Are
Yes.
there areas of the body that have been very different in his growth?
Yeah, his whole right side of his body is bigger than the left. It's longer, and it's just mass-wise is much bigger, including his organs on the right side are bigger, and just his overall mass. He shares clothes with our 6-year-old, and he
Wow.
just turned 3 2 days ago. So he is very, very big.
So, Dr. Aguilar, with that said, a lot of people would love for their children, to grow faster and be bigger. When it relates to, maybe sports or other things they want to get involved in. But is that something to be concerned with as it relates to it being a part of this condition?
Well, she actually described the condition very well in that, unfortunately, it does tend to have different growth rates on different halves of the body. So that's why she said the right side is bigger than the left side. And that's going to persist until growth stops. And it's not usually a problem because nobody grows so big that they don't grow on the opposite side. But it'll always be like that. And there's nothing really we have available to stop that or equalize that.
Okay.
She'll notice it in the face. She'll notice it in the length of the upper arms and length of the pelvis on one side and the leg. But it's something he'll adapt to fairly well over time.
I guess it being part of him growing, he's, like with anything, he's going to learn to adapt with it as it happens. So we are coming to an end, but I want to thank you both, Dr. Aguilar with Houston Plastic and Reconstructive Surgery, for joining us, and Theresa and Owen. It's been a pleasure having you guys and learning all about this condition. Tell us the apparel, where they can find it. I know we spoke about it earlier in the episode, but give us the link or the website that we can go and shop around.
Sure, it's called Rare, and the website link is www.findyourrare.com.
Awesome, and I have a shirt on the way. I ordered it, and it's going to be here Friday, so I'm excited to be a part of that as well. But thank you both so very much, and we'll look forward to keeping in touch.
Thank you, Jessica.
Thank you. I appreciate all of you viewers listening in. Beckwith-Wiedemann Syndrome. It was very interesting to learn about, and I will provide some links so that you can learn more on your free time, and hopefully it's able to help you or someone you know. So we'll see you next week right back here at 7:30 p.m. on Tuesday.